So I'm going to talk about cognitive behavioral intervention for children with aggressive behavior problems. And I'm going to talk a lot about how we try to think about interventions, even once they become evidence-based, are still organic in the sense that they change. They can change, probably should change, and that we need to think about how to do that and what are examples and ways we should do that. So our coping power work, my coping power work started actually a long time back. So back in 1976, a long time ago, we published a book on intervening in schools in a preventive way in order to help children reduce behavior problems and using kind of a behavioral systems approach. And those principles are still really what undergird what we do now. So it's odd how things you do early in your career continue to be there many years later. Back in the late 70s, around 1980, we became interested in working with children who had aggressive behavior, and using some of the work at that time of Lazarus and Navaco, we developed a intervention called anger coping for children who had aggressive behavior problems. And the model that we used at that time kind of looked like this, and you can't really see that, but the focus here was on children's cognitive processing of the difficult event they had, so their misperception of that event, making attributional errors and misperceptions, and that as they made errors or had ways of thinking about that event, they'd have some physiological arousal, so their autonomic nervous system kicks in, and then the effect of that arousal state and then the misperceptions they had of the event led them to think about how they're going to respond to the event and have these errors in problem solving. So the key things about at that time that we thought an intervention for these children, what it really should include, was a focus on their misperceptions and arousal at the first step, and then on how they think about resolving the problems they have. And so kind of an emotion regulation part and then a cognitive processing part. And that's still there. That's still a large part of what we do in coping power, which has, in its full version, there's a child component that has 34 sessions, a parent component that has 16 sessions, so pretty lengthy programs. And then we also work with some with teachers, with teacher consultation.